Jaundice occurs in about 60% of all newborns. Jaundice is a yellow discoloration of the skin and the whites of the eyes. It's caused by a buildup in the blood of a yellow pigment called bilirubin. As we learned from Dr. Cameo Carter of Redlands Community Hospital in Redlands, childhood jaundice is easily treated.
Jaundice is really a description of the physical signs and not really a description of what causes it. Jaundice can be caused by a lot of things, but what people notice a lot, actual yellowing, sometimes so yellow that it becomes a little green of the skin, also the whites of the eyes, and the mucous membranes. Mucous membranes are like inside the mouth even, or the nares, nasal passages. So these can become yellow, and it can be very alarming for a parent to see a baby coming out and looking nice and pink, and within a couple of days starting to take on a new tone to their skin that doesn't look healthy. And so that's what jaundice is the actual coloring. Now what it is caused by is an increase in bilirubin. And what bilirubin is a byproduct of the breakdown of red blood cells. So all of us have red blood cells in our body, and each red blood cell lasts for about 120 days. Each individual cell has a lifespan that long. And after it is no longer needed, it's gone through the 120 days, it is degraded or broken down into different parts. And the liver and the biliary system is what does that. And one of the byproducts is bilirubin. And if too much accumulates, then it can start laying around places. And one of the places it lays around when there's extra is the skin.
We asked Dr. Carter how jaundice is treated.
The treatment for jaundice really depends on what's causing it. So there's lots of different things that can cause it. It can be normal, what we call physiologic, or there can be different infections, different concerning things can cause it too. So the doctor's job is to figure out what is causing the jaundice, and then depending on what is causing it, we treat. If it's infection, we're treating it. If it's because they're waiting for the milk to come in, the breast milk isn't in yet, and there's some dehydration, we give more volume. And if that number is really too high, there's a couple of options for treatment in addition to maybe giving more volume orally, supplementing with formula before breast milk has come in. You can also give IV fluids, which help bring that down, and phototherapy. And these are what you've maybe seen in pictures, or if you've had family members who have jaundice, have to have bright lights, and they wear little eye patches to protect their eyes. But that helps break down and bring those numbers lower. If it gets very high, specialized procedure can be done called an exchange transfusion, and what happens is the baby basically gets a whole new set of blood, and then that is cycled through and helps bring the bilirubin down.
We ask about the success rate for jaundice treatments.
It is easily detected and easily monitored and can be treated very quickly. If it is allowed to go too high before medical intervention, that's when trouble can happen. So if a parent is home with their infant and noticing that the baby is getting more and more yellow, getting more sleepy and not waking up on their own for feeds, and seeming less what we call vigorous, having less movement, then they need to seek medical attention very soon, because wonderful things can be done and be done very quickly, and we're very successful at it.